Hi and welcome. Today is the first of 5 parts of a lecture series about evidence-based medicine and evidence-based practice. So this first lecture is called Ask, and that is the first step in this process, forming a good clinical question. So we're going to delve into that today. My name's Sarah Villery. I am excited to be here with all of you, so thank you for coming and spending your lunch with me. We have some in-person participants. We also have a Zoom session going, people watching on Zoom, and then we are going to be recording this so that we can post it and people can watch it asynchronously later. So a little about me. I am part of your library instruction team here at Red Rocks. I'm also an adult gerontology primary care nurse practitioner. So I practiced in direct clinical care for over 10 years. Mainly in sexual and reproductive health, but I've also worked in telemedicine and geriatrics as well. I am earning my Master's of Library Science this December from Emporia State with a Health Information Professionals concentration. And I earned my Master's of Nursing and Bachelor's of Nursing from Northeastern University. Here is our agenda for today. So I'm going to provide an introduction to your library and some of the resources that you have access to here on the Arvada campus. We'll talk about what is evidence-based practice, why is it important, and how can I apply it? And then we are going to dive into that first step in the process, ask, and talk a little bit about what's next and what to expect in the other 4 sessions. So we are going to talk more about specific library resources throughout the whole series. But today I just wanted to give you a really brief overview of what you have access to, especially here at the Arvada campus. So the main library is located on the Lakewood campus, but we do have an office here for you in room 7166. We are here in person Wednesdays and Thursdays from 9 to 4 p.m. And we do house some health sciences specific print materials here. So things like textbooks, books for you to check out, some drug guides, clinical handbooks, things like that. If you find something in the catalog that is housed at Lakewood, we can also get it for you here. So whatever you need in print, we can get it to you if we don't have it here on site. You also have access to a lot of electronic resources like databases, and we have some health sciences specific ones like Access Medicine and CINAHL and PubMed. And then we have a library of things. So that includes anatomical models. We have a skeleton, a skull, a heart, a torso. We are getting a brain model. So you can check those out from us. We also have things like laptops, chargers, parks passes, Colorado State Parks passes, things like that. So come visit us at the office and we can help you with all of these things. One of the other things that we do, and a big part of our job, is helping with your research. So we can help at any point in the research process. So this may be coming up with your topic or defining your research question. It may be doing a background literature search, citing your sources, even presenting your research findings through a paper or a presentation. So we can help you at any point along the process. We do in-person and virtual one-on-one sessions with you, and we can make them as long as you need, anywhere from 20 minutes up to several hours if you need. So to book that, you can scan the QR code here. You can also book it directly from the library website, which is listed here at the bottom, rrcc.edu/library-services. And then we do also have through our website a 24/7 chat service that's available. So this is through a consortium. You won't necessarily be talking to one of us here at Red Rocks, though you may. But 24 hours a day, you can access a librarian around the globe who can help you with your research. So before we get started, just a quick poll. How many of you are health sciences students? Raise your hand. Nice. And have you ever learned about evidence-based practice before? A little bit? Yeah. Have you ever worked in a clinical setting before? Yeah. And did you use evidence-based practice in your clinical setting? Yeah. So one of the reasons that we at the library wanted to cover this topic over the next few months is really to help you understand the value of evidence-based knowledge and how to apply it in a clinical setting. So throughout these sessions, I hope that you learn how to find, retrieve, and use health information. But beyond that, to take it a step further and really understand how to interact with that information and apply it to the patient who's sitting in front of you. So hopefully this can help you throughout your time at Red Rocks and then beyond once you move into a clinical practice. So what is evidence-based practice? Within health sciences, this can also be referred to as evidence-based medicine or evidence-based nursing. And it really came about and started to form in the 70s, in the 1970s, but it wasn't given a formal definition until 1996 as the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. And this definition is still used in the literature today. But what that means is that you're forming a care plan based on three things: the best available evidence, meaning research; clinical expertise, meaning a licensed practitioner's education and judgment and experiences; and patient preferences, meaning that you are taking into account the patient values and beliefs, and they're part of this clinical decision-making process. So you need all three pieces to form a really good plan of care. And today, evidence-based medicine is considered the foundation of safe and quality patient care. So it really helps us connect theory and research into our practice. And why is evidence-based practice important? Well, it really optimizes your decision-making so that you can harness relevant research as you make a decision with the patient. It ensures that you're providing the most effective care for every single patient, and it really individualizes your care for the patients also. So instead of relying on tradition or anecdotes or one expert's opinion, you're relying on the evidence and the individual characteristics of your patient. And it is considered the standard by healthcare organizations and regulatory agencies nationally and internationally. So like the American Nursing Association, the CDC, they recommend that you use evidence-based practice. So why they recommend it is because we know that it reduces variations in practice. So it creates more standard practice across healthcare providers. It enhances the quality of care for every patient. It reduces healthcare costs. It increases patient safety because it reduces risks and it reduces the number of errors that are made. And overall, it just improves patient outcomes. So this is the ultimate goal, right? Is we want to improve the outcomes for our patients. So patients benefit, providers benefit, healthcare organizations benefit, and it is a win-win-win. So we're going to take a look at a case study. And again, this is from my expertise in sexual health. So imagine that you are a healthcare provider in a sexual health clinic in New York City, and a patient comes to you and he says, "I've noticed some discharge in my underwear." So you take a more thorough history. HPI stands for History of Present Illness. And you learn that he's a 25-year-old cisgender male. He's had yellow urethral discharge and dysuria, meaning pain with urination, for 2 days. And in the last 3 months, he reports condomless sex with 5 cisgender male partners. He has no relevant medical or surgical history. He is HIV negative, taking Descovy as PrEP, and he has no drug allergies. So you perform a physical exam, you do your stat lab, a gram stain, and you find that he is positive for gonorrhea. So without evidence-based medicine, I may treat this patient based on the gonorrhea treatment that I learned in school, which was a dual therapy, ceftriaxone, and azithromycin. But is this treatment still effective? I went to school a really long time ago, right? And even more than that, I have a lot of other questions about this case. Like, do I need to collect a culture for this patient? Do I need to do a test of cure, which is where I bring him back in 7 to 14 days to retest him? Or just recommend routine screening, which for patients on PrEP is every 3 months. Should I treat him presumptively for chlamydia? So I have a lot of questions, and to answer these questions, I need to go to the evidence. So how can we actually apply evidence-based practice and use it to answer these questions that I have for my patient? This is done through a structured process, so it's called the 5 A's. And the first step is ask, forming a clinical question. The second step is acquire. You find the best evidence. The third step is appraise. You critically appraise the validity, reliability, and usefulness of the evidence. The fourth step is apply. So you actually synthesize, bring it all together with your clinical expertise and the patient values. And then the last step is assess, where you actually evaluate the process. You check to see if there's any new evidence that you have. You start over if you need to. Now, you may notice that we have 5 sessions in our lecture series and that there are 5 steps in the evidence-based process, and that's not a coincidence. So throughout this lecture series, each session, we're going to dive into one of these steps. So today we are going to talk about ask and forming a good clinical question. And then the other sessions will cover acquire, appraise, apply, and assess more in depth. Any questions up to this point about the library, about an overview of evidence-based practice? Anyone on Zoom? Okay, no questions. Okay, so step 1 is ask, forming your clinical question. So first you recognize that you need additional information, right? And then you translate that into a well-built clinical question. So there are 2 types of clinical questions: background questions and foreground questions. And it's really important to identify which question type you're asking, because this will tell you where to look for the information. So background questions seek more general information. A lot of times they can be answered by textbooks or clinical guidelines or practice guidelines. You can find the answer in point of care tools. And they're usually a question root, like who, what, when, with a verb. So some examples of a background question may be, what causes hypertension? How often should women over 21 have a pap smear? They're more basic, right? They're more like introductory, and they apply to large groups of patients, right? Foreground questions are a lot more specific to the patient in front of you, and you're going to use these questions to really inform your clinical decisions. They usually require searching journals and other literature. And to create a foreground question, you usually use the PICO question format, which we're going to talk about in a couple of slides. And this has 3 to 4 components. So it's a lot more specific to your patient. And so one example of this may be, in adults, what is the effect of a work-based exercise program on stress reduction compared with no intervention? So going back to our case study, can anybody think of a background question that we may ask? So a who, what, when, where question related to our case study. Well, here's some that I have come up with. How is gonorrhea transmitted? What are the clinical manifestations of gonorrhea? How is gonorrhea commonly treated? When should people be tested for gonorrhea? Who's at highest risk for gonorrhea? How can you protect against gonorrhea? So this list can go on, right? We are going to talk about where to find the information in our next session. So I'll go more into detail about that. But for this example, I'll just use the question, how is gonorrhea commonly treated? Because I want to know what antibiotics to use for my patient, right? And so I'm going to go right to the source, the CDC Sexually Transmitted Infections Treatment Guidelines. And lo and behold, they updated their guidelines in 2021. And that was after I went to school. I won't tell you when I went to school, but it was before 2021. And they have updated the treatment. So now for uncomplicated urethral gonorrhea, they recommend just monotherapy ceftriaxone at a much higher dose, 500 milligrams. And this is a weight-dependent dosage. So if I had treated my patient with 250 milligrams of ceftriaxone plus azithromycin, he would have been undertreated, right? Meaning he would have had a persistent infection that could have led to ongoing complications that would have led to transmission if he thought he was treated and he shared it with other people. And this is going to increase the risk for gonorrhea resistance. So gonorrhea is a very interesting organism in that it evolves very, very quickly and has become resistant to multiple antibiotics throughout time. So we don't want to develop more antibiotic resistance to ceftriaxone. There are not many options left to treat gonorrhea at this point. So we definitely don't want to undertreat this patient. Any questions about background questions at this point? Okay. So moving into foreground questions, I mentioned the PICO format. So PICO is an acronym to help you put together more refined patient questions, right, or clinical questions. So it helps you come up with a clear answerable question from a more broad topic. So the acronym P can stand for patient, problem, or population. I for intervention, C for comparison, O for outcome. And then people can also use a T or an S for the PICO framework, and T can stand for time. It can also stand for type of question or type of study, and then S can stand for setting. So those ones are more optional if you'd like to include them. But looking at what each of those element means, P, the patient, the population, the problem, this is who is your patient? So this may include age, it may include sex. It's things that you think would be pertinent to your research question. It may be a population, like a group of people that lives in a geographic area, for example. It may be a problem, like the main medical problem that you're looking at. I, intervention, what do you plan on doing for your patient? So this is your main variable, right? It may be a diagnostic test, a medication, or a therapy. It may be a procedure. C, what alternative are you considering? So maybe you're comparing to a different test or a different medication or procedure. Maybe you're comparing to like current practice, right? Maybe you're looking at a control group and no intervention. So you can choose what you want your comparison to be. O is what do you want to accomplish with your patient? So this may be an accurate diagnosis. It may be improving or relieving symptoms. It may be full treatment or curing an illness. It may be just maintaining function. And maybe you don't have your outcome yet because you're early on in the research process and you're not sure what the outcome is supposed to be. And that's okay. Maybe you need to start doing your research first and then you add on the outcome piece later. But looking at just like a general example of how this works, let's say that we have a patient who comes to you and is experiencing symptoms related to menopause. So if we were to do just a general search in the Red Rocks Library website for menopause, you're going to get 230,000 different results, right? So we really need to narrow down our search and our question to make this more specific to the patient sitting in front of us, because we can't go through 230,000 results. So maybe this patient is asking to help you manage her symptoms around hot flashes, right? And so you're thinking about a couple different treatments that you learned about. Hormone replacement therapy and black cohosh are both treatments for managing hot flashes. And so you want to compare and see which one is more effective for that symptom specifically. So plugging this into the PICO format, your patient or your P could be menopause for a problem. You could also do menopausal woman. Your intervention, maybe you're looking at hormone replacement therapy as like the primary intervention, and you want to compare it to black cohosh. And then your outcome, you do want this to be a measurable outcome. So severity of hot flashes, maybe you are looking at frequency of hot flashes, but you want to do something that you can actually measure. So your question would be, putting this all together, in menopausal women, your P, how does HRT, hormone replacement therapy, your I, affect the severity of hot flashes compared to black cohosh? And if we pull out each of those PICO elements and use those as our search terms, we now get 1,300 results, which is a lot more manageable to go through, and we can narrow this even more if we wanted to. But you can see how this can be helpful and turn it into a search later on, which we're going to talk about a little bit more next week too, how to actually convert it into a search. So just to look at a couple other examples using the case study that we had, I created this PICO question. So my patient, is a man who has sex with men with urethral gonorrhea. The intervention that I'm looking at is a test of cure. So having him come back in 7 to 14 days to retest him, compared to just routine STI screening. And the outcome is rates of reinfection. So does a test of cure reduce the rates of reinfection compared with routine screening in cisgender men who have sex with men treated for urethral gonorrhea? Or another one. So my patient, a cisgender man who has sex with men. My I in this case, or the variable that I'm looking at, is urethral gonorrhea. My C, or comparison, is not having urethral gonorrhea, right? Being negative for urethral gonorrhea. And my outcome is chlamydia infection. So are cisgender men who have sex with men who have urethral gonorrhea compared with those without gonorrhea at increased risk of chlamydia infection, because maybe then I want to treat him presumptively for chlamydia. So they do have PICO templates, which help you format your question. So it helps you take the PICO elements and put it into a sentence format. And so I am going to make this available to you at the end. I'll show you where you can find these, but they can be really helpful. And usually they're organized by question type. So what type of question are you asking? And that tells you how to plug in the PICO elements. So for example, the intervention question in P, your patient, how does I, your intervention, compared to C, your comparison, affect O, your outcome, and then within a time frame if you would like to have that. So these can be really helpful. Once you determine what your PICO elements are, you can pull one of these out and it'll help you format the question. Any questions about PICO? So at this point, we're going to do a brief activity. So we're going to practice making good PICO questions. So we have an activity sheet, which you all should have, or I will pass it out for you. And so it's a list of bad PICO questions that with a partner, or we can just do it as a group too. We'll just pick one of the bad PICO questions, talk about why you think it's a bad PICO question, and then rewrite it to be a good PICO question. So maybe it's missing some of the elements. Maybe it's not specific enough. Maybe it's too detailed. Take a look, talk about it. We'll come back together in about 5 minutes and see what you all came up with. And so here is the activity sheet. If you are watching this as a recording, you can just pause and go through the activity on your own. And then when you're ready to reconvene, you can come back and press play. If you're on Zoom, give me 1 minute. I'm going to send this out to you through the chat. So just some general guidelines and things to keep in mind when you are coming up with your PICO question. You do want to clearly define your patient group or the population. You want to include a focused intervention. Make sure that you identify a specific measurable outcome. You want a relevant comparison group, right? So it wouldn't make sense to compare Tylenol to something that doesn't help with headache, for example. I don't know. I'm struggling to come up with something right now. But you want it to be relevant and within your topic at least. You want to avoid really broad and vague questions. But on the other end, you also really want to avoid unnecessary details because you don't want your search to be so narrow that you come back with 0 results, right? So now that you have your clinical question, now what? How do you find the answer in the research? And so that leads up to our upcoming evidence-based practice session. So you're invited to the second session, Acquire, which is on December 2nd from 12 to 1 in this room. It's also going to be on Zoom with the same link, and we'll also send that out as well again. So in this session, we're going to cover search strategies, how to translate your question into a search of the literature. We'll discuss levels of evidence and the evidence hierarchy, including what study type is most appropriate for what types of questions you're asking. We'll cover how to search for the evidence, including different databases. So specifically the health sciences databases that you have access to through the library here. And then we'll go through a practice search together. After that, as I mentioned, we're going to be covering the other steps in the process. That will be in the spring. Those dates are TBD at this point, but the appraise session will be sometime in February. Apply will be in March, and assess will be in April, and we will keep you updated on the specific dates for those sessions. I mentioned that I will give you the PICO template. So I've created a research LibGuide to supplement this lecture series. So it's available through this QR code here. You can also access it through the library website under the research guides, or just going straight to this URL here. And so this is going to include general information about evidence-based practice. LibGuides, we can link different articles, tutorials, videos, things that we think will be helpful for you on this topic. And then I did also create one for each of the lecture series. So there's an ask page as well that covers putting together your PICO question. It includes the PICO templates that you can use. It includes other video tutorials to just give you more information on that if it's still a little murky. And then throughout the series, I'll add other resources for you for the other sessions. Here are the references that I used for this lecture.